There is no era in the history of mankind that shows the degeneration of the mouth as that which is happening in modern history.
And this is what's happening. I will go from hunter-gatherer to this is current me, industrial me, and this is me if we continue along this trajectory.
Why do most kids need braces today when our ancestors didn't have crooked teeth?
As this has happened in the evolutionary blink of an eye, what I see every day: narrow dental arches, vaulted palates, the mouths hanging open, mouth breathing, and crooked teeth.
This isn't just genetics, and it isn't just cosmetics. A shrinking mouth creates a shrinking airway.
Obstructive sleep apnea. Every night, roller coaster between suffocation, stress response, suffocation, stress response.
When you combine this shrinking mouth with growing rates of obesity, you have a serious problem.
So this is a scary sleep disorder. Dentists have a front row seat to see obesity in the mouth and the dire consequences of airway obstruction.
Oral health problems are so universal that we think they are normal.
I got braces, I had headgear, a couple years later I had to get my wisdom teeth out. All of this totally normal these days. The most common disease in the world: dental cavities. So although we have normalized cavities today, they're not normal.
These problems are common, but not normal. No other species have mouths with crooked, crowded, and impacted teeth. Teeth filled with holes and embedded in gums that bleed and in bone that's being eaten away. Mouths with a fatty tongue and a shrinking airway that gets blocked when we're trying to breathe when we sleep. Why do we have these problems?
The mouth is the canary in the coal mine. It is the early warning system that is telling us when our diet is off.
The mouth is telling us what to eat. And in this keynote, I translate what it's saying.
It's our pleasure to introduce Dr. Kevin Stock.
The one thing, if you could kind of go over this here with this dental evidence that other species don't have mouths with crooked, crowded, impacted teeth, fillings, embedded, inflamed gingivitis, fatty tongue, and narrow airways that is causing, you don't see a chipmunk snoring or a rabbit or any species. So if you could maybe add a little to that.
Yeah, besides basically the dogs that we domesticate.
Exactly.
So, right. Excuse me, I just took up the funny breath.
I think I have an airway device for that.
Right. So, and these things are all related. Cavities, periodontal disease, fatty tongue is what I call it. They're all diet-related diseases that manifest in the mouth. And they are so common that we tend to think they're normal. For example, it's very much the norm for kids. I do pediatric dentistry as well. For kids to have cavities, so normal that it's just another, like, you go to the dentist, oh, you got cavities, we do some fillings, etc., and you go on. And I think something that we're going to probably talk about here today is like how, like, I like to say, it's the canary in the coal mine often, where if your teeth are rotting, literally the hardest substance in your body, tooth enamel, is being rotten away because of what you're eating. I think it's a pretty good indication that what you're eating is not appropriate. And so it often is the canary in the coal mine, which is this early warning system that can tell us when our diet is off. And dentists, I think they have we get some of the earliest warning signs that are often ignored, because I'll see a kid with cavities and they're 6 years old, where, they go to the pediatrician gives them a clean bill of health. They're like, oh, you're yay tall, you're developing more or less fine, don't have any diseases, okay, you're fine. But the mouth tells a different story. And often those problems that I see in the mouth will later manifest as diabetes, obesity, metabolic syndrome, and the sequela of negative impacts that relate from that, like obstructive sleep apnea as well.
Yeah, I'd have to say, like, I'm sure you've never seen a mouth full of oral dishealth and have it be attached to a healthy person. Just doesn't happen. Here we go, Kevin. I've got this. I love this graphic I made because I love your canary in the coal mine part of your meat mouth presentation. So here, the mouth is the canary in the coal mine. It's the early warning sign when your diet is off. So any of you have bleeding gums, a diagnosis of gingivitis, in need of root canals, and we'll talk about that too, because that's something I know somebody has already asked about in the comments. And thank you all to those who are here now joining us live. But like in my profession, 9 out of 10 dentists in your profession are trying to just patch this and really smash the fires that are smoldering in their mouth, right? And they recommend all these elaborate rinses, washes, flosses, crowns, extractions, canal, all of this stuff, prosthetics. And it's basically just how I feel it is with eyes. You're masking it and it's not getting to the root cause.
Yeah, absolutely. And I find so much of this so interesting. My brother's actually an ophthalmologist, and we talk about a lot of the stuff. I think myopia is fascinating because if you think like it from an ancestral perspective, you have myopia, you're
Screwed.
yeah, you're gone. You are not. You're going to be
You're the
natural
man
selection.
inside doing the cave painting at 10 inches in
Yeah,
front of your
natural
face.
selection is going to move you right off the right off the face of the planet.
Darwinian.
Exactly. And I actually read some interesting research not too long ago. It was a CE course I was taking, and they were saying the two healthcare professionals that are most likely to catch diabetes early are dentists and eye doctors. And I'm like, oh, interesting. So, like when we're talking about the canary in the coal mine, here we are. How do we
Exactly.
where do problems first manifest, and can we catch them early? And I think, definitely the mouth is one of these canary in the coal mines, especially with cavities, but periodontal disease is a big one. So 47% of US adults in the United States have periodontal disease. And periodontal disease is gum disease where the bone that holds your teeth in is being eaten away. So it's a chronic disease that is like I mean, it's pretty like when you put it like that, people are a little startled. They're like, oh, bacteria are eating away at the bone that are holding my teeth in. And nearly 50% of people and adults in the United States have it. And there is a mountain of research that connects periodontal disease with almost every single chronic disease you can think of. And so much so, the associations are so strong that people would thought that the periodontal disease was causing these other diseases. Now, I think it might play a role in exacerbating some of these things. I just think they're more likely that we have a common root cause of mainly like a poor diet that is both leading to periodontal disease and this, myriad of other chronic diseases.
So, and we can get into here, the key for root cause prevention really ultimately comes down to limiting the carbs, limiting the refined grains and sugars, and those dang nasty toxic poisonous seed oils, which are, have such a long half-life that eat a French fry today, it'll still be there 4 years. It's that serious, and it's just a very slow suicide. And people don't know. I mean, we know, but we're in this space. But it's really so important that we talk about this, and in our professions, talk about it with our patients. But was talking about the zinc isotopes in the tooth. Was it the enamel or the dent, and also the calculus is mineralized, so it really stays in fossil stages, right?
Yeah, and we can actually use all three of those to date teeth. And so it's super interesting. And for that presentation, the keto kind of presentation, they said, okay, you had 30 minutes and leave 10 minutes for Q&A. So I remember I was putting the presentation together, and my round one, I was like, all right, I'm gonna practice it. It's like 2.5 hours long. So I had to cut so much stuff. And some of the stuff you're just talking about was some of the stuff I had to cut out, especially how certain things I found so fascinating. I am fascinated by archaeology, and anthropology and the fossil record. And one of the fascinating things is the dental calculus. That's the stuff that the hygienist goes in scraping off your teeth, because that preserves in the fossil record. And it basically acts as a snapshot of your microbiome, like the bacteria in your mouth in time. And there's fascinating research done that was showing the changes in dental calculus, basically the bacteria in the dental calculus, at three unique times in history. One was like, okay, this was hunter-gatherer calculus, and it was more or less, we'll just call it a balanced microbiome. And then with the agricultural revolution, what they saw was the rise of karyogenic strands of bacteria in the calculus, mainly strep mutans. And then there was a major shift there. And then there was another major shift that happened around the Industrial Revolution, where these karyogenic strands of bacteria became basically predominant. And so it's so fascinating to see how those major dietary changes we can see in the fossil record in the dental calculus, which tells us what was going on with the bacteria in the mouth during those transitions.
Yeah, it's so fascinating. It really is. So, all right. So here, this is so impactful looking at this. Can you kind of explain what's going on here?
Yeah, so I think a lot of similarities here with the eyes and the teeth is a lot of people think it's just genetics, right? And they just pawn everything off to genetics. I got crooked teeth, it's genetics. I got sleep apnea, it's genetics. I got cavities, it's genetics. I get it passed on from my parents. And genetics play a role in everything, obviously. Epigenetics play a significant role in things as well. Um, but here, so the first kind of picture at the top left is a skeleton. It's a good example. It's an older skeleton and no cavities. All 32 teeth fit in. They came in straight. No abscesses, no impactions. And this was the norm prior to the agricultural revolution. And it would be a strange natural selection phenomenon to select for teeth that are crooked or that are easily rotting.
Or totally missing.
Yeah, exactly. So that's generally not how evolution natural selection works. So if we're looking at archaeology, it doesn't make a lot of sense. So a lot of this is not genetics, especially crooked teeth, especially cavities, periodontal disease, and our shrinking airways, so obstructive sleep apnea and such. And one of these pictures, the bottom middle one. So there's stories that go with all these pictures, but the bottom middle one is from Dr. Weston A. Price, who are people not familiar with. He was a dentist in the earlier 20th century, traveled the world at a unique time in history where we had airplanes, we had the photography, and we had the intersection of traditional indigenous diets and the modernization of diets, notably lots of refined grains and sugars. And so he traveled the world and he basically studied populations right next to each other. One population eating a traditional diet, another population with the modern food, the modern food, the displacing foods of modern commerce is what he called them. And he documented all of his findings, like a tremendous amount of observational research. In his seminal book, it's called Nutrition and Physical Degeneration. Highly recommend it. It is a long book, kind of repetitive, but it basically found the same thing across the world. And that is those people that were eating mostly their traditional diet, they overall had healthy mouths and healthy bodies. And when the displacing foods of modern commerce came in, they rapidly got cavities. The first generation got cavities right away. Second generation not only got cavities, but they also developed malocclusion. So, I mean, the theory of like, it's just genetics. Dr. Weston Price did a lot to kind of disprove that theory all by himself.
Goes right
So,
out the window. So, and then here you have the shrinking palate. So many kids have to wear palate expanders, and
yes.
their teeth don't fit in their mouth, right? And then the ever prominent cavities also.
Yeah, and when it comes to malocclusion like this with a vaulted palate, and I see this, it's almost the norm now, unfortunately. It is multifactorial, like causes are multifactorial, but I think that there's actually a root cause in diet, and it is really two things. I talk about growing your face is kind of like growing a muscle. If you want to grow a muscle, you need proper nutrition and you also need the proper stresses of that muscle. If you just eat well, but you don't move the muscle at all, it's not going to grow as it should. If you move the muscle, but you don't have the right nutrition, it also is not going to optimally develop. And so our faces, notably the maxilla and the mandible, the maxilla is the top jaw, the mandible is the bottom jaw. And many people, myself included, are underdeveloped. And a root cause issue of that is malnutrition, meaning we're not eating enough meat mostly, and we're also not chewing enough. So we're not chewing enough meat. Breastfeeding versus bottle feeding also plays a big role in this. And because of various dynamics in play here, it often will lead to mouth breathing, which will exacerbate the whole issue. So I think that there's a root cause in diet that we see then in mouth breathing, we see in poor oral posture, and it just exacerbates everything. Starts to create long face syndrome. Kind of, I see it when I look in the mirror, unfortunately, where we have long, narrow faces. Typically, often we'll see a receding chin, although sometimes it'll look like it's more class 3, which is not to get into all the dynamics of it, but further out. Also, like receding maxillas and such. But yeah, all this leads to a shrinking mouth, malocclusion, and smaller airways.
And that's interesting looking. That picture right there with the soft palate, that child clearly can't lay the tongue up onto that palate like they're supposed to. So over in the live chat, interesting question from Christina saying, curious how diet actually makes the teeth crooked.
So I would say how diet makes the teeth. It's actually an inadequate diet will lead to crooked teeth. It's not that the diet will make
Cause it.
yeah,
Right.
cause the tooth to, like, you're eating something and so then teeth start coming in crooked. No, it's mostly for, like, so we have the top jaw and the bottom jaw, and we need them to basically fully develop. And if they don't, we have 32 teeth that are trying to come in, but there's not enough room for them all to come in. So they start just coming in wherever they can, and that's what leads to crooked teeth in a majority of the cases.
Yeah. And I have Dr. Mark Hirsch over in the comments. Thank you for joining in. And he says, love hearing you talk about the teeth and eyes. Wish I had a clue about this when I was practicing family medicine. He's a retired physician. I never made diet suggestions. Yeah. And the issue really is, you're not taught that in med school, right? I mean, that's a big part of the issue. So, but yeah, now we all should be educating ourselves and really practicing root cause medicine.